Well, June is Men's Health Month. It's all about raising awareness of and making healthy life choices, regular doctor visits, health education, starting the conversation with male friends, and so much more. Dr. Groll is here to help us break down the awareness and what we all can do. How are you?
Doing great. Thanks for having me.
Absolutely. Thank you for coming. I read a statistic that you gave us. 40% when there's a problem getting pregnant, 40% of the time it's because of the male.
Or contributing, and so that, and go figure, half the equation.
Yeah,
So
yeah.
Not too surprising about half the time that there is a male factor involved. And it may not be the only factor, but oftentimes we may have both female factors and a contributing male factor with a low count or a low motility that, could be part of the equation in ways that we can help.
How can we help our men out there?
So, when we look first is to get tested. Very few risk factors or things that are going to predict a low count. So the first is just to get checked. And then, things that we can do to help in terms of just their own activities. There's a lot of ways they can minimize exposures or damaging, things to the sperm so that give them their best chance.
Lifting weights. This really shocked me. That is not such a good idea if you're trying to have a baby.
So from a couple different things. Now, fitness obviously is great. We want
Right.
to make sure people are healthy, but there is some data looking at strenuous exercise. So whether it's from just the inflammation or from the temperature elevation, that could have some detriment in terms of either the hormones or the environment. But also there's a lot of folks who use performance enhancers, that it's not just for the professional athletes, that a lot of people like to look good in their swimsuits in summer, and they will do courses of either supplements or not so supplement substances in their bodies. And they really do have an impact. They can suppress their hormones and can drive guys all the way to a count of 0 without knowing it. And
Wow.
so really anything that they're adding into their bodies, we would want to be able to know about from a physician standpoint, but then also realizing that can be a negative and can hurt their chances.
If a couple's having problems and they come to you, what do you then do next?
So we would first, get their testing ordered, and then as we start treatment, we usually have the guys take some supplements, which could be, directed to what we find on their tests. But some common things are antioxidants that help kind of clear inflammation. There's also essential amino acids like L-carnitine is one that helps promote more, production. And then a great supplement is something called coenzyme Q10. And what that does, it's a mitochondrial factor that will help their energy so we get better motility.
The testing's unbelievable now.
And so, we have a standard semen analysis, which is going to tell us, how much we're making. But there's advanced tests where we can check to see actually if the DNA is breaking down in the cells themselves and showing a sign of damage. We can also check hormone levels and get genetic testing on the dads. They can get screened for carriers of various, genetic mutations and things that can all play a role. So it's very exciting to have so much, that we can now do and, provide more options.
That is great news. Doctor, how do we find out more information about you and what you do?
So you can reach us at our website at SpringCreekFertility.com, and also reaching our office at 458-5084. And we're located right over in Centerville at 7095 Clio Road.
Thank you so much. We
All
appreciate
right.
it.
Thanks.